Hi guys, today we're going to talk to you about another article I was reviewing. It is a good article. It definitely has some points that are really good to consider, and it has some others that might be beneficial for you to have a look through. This one was done by Dr. Stillman and her colleagues. Essentially, this one's is titled Concussions, Evaluation and Management. So like the title says, firstly, it talks about the evaluation process when you sustain a concussion and what kind of the bare minimums should be done or should be followed when you have a head injury. So the first things, and I agree with these wholeheartedly, is you need to do a cognitive test. You need to do a cranial nerve testing with those patients. You should be doing testing with regards to their strength, their sensations, their reflexes, their coordination, and their balance. So on the bare minimum, you should be at least doing these tests when you have a head injury. So whatever healthcare provider you are going to see, I agree, those tests should be done. Now, when it comes to something that might be a little bit more severe in nature, the article here does talk about kind of those red flags, those warning signs that should be attributed when you should be getting a CT scan when we're worried that maybe something's going on, potentially like internal bleeding or hemorrhaging. But again, it's up to hopefully the healthcare provider that you're seeing to kind of see those red flags and kind of push you along if that's warranted. But back to the article here, the other things that they talk about in terms of management, and this could kind of be interesting to some patients, they talk about headaches and they talk about sleep. And with regards to those symptoms, they do list some of the medications that are commonly practiced in terms of providing to the patients. And it does vary kind of patient to patient. So you do have to talk with your individual healthcare provider to figure out, or your practitioner to figure out which medication would be best for your particular situation. But this article does go through some of those medications for you. The other thing that it talks about here is with regards to dizziness. So this is a kind of a nice thing that it says that if you have dizziness that kind of goes longer than that 4 to 6 weeks time frame, it does kind of say that or warrant that at that point you should be seeking some practitioner that's trained in vestibular or concussion rehabilitation to help you with that point. It talks about some of the different factors that might be kind of contributing to the dizziness itself, whether that be vertiginous in nature from BPPV, whether that be visual discrepancies that you might be having, whether it's convergence insufficiency, convergence spasms, so maybe it's orthostatic issues. Regardless, it goes through some of the details and it kind of says essentially the premise of if you are still having that dizziness beyond those 4 to 6 weeks, that you should be seeking treatment at that point by someone who's trained in those vestibular rehabilitation maneuvers or procedures. One of the other aspects that it touches on is with regards to that the emotional aspect or the cognitive aspect of recovery, and kind of saying that essentially if you are suffering from more that psychological phenomenon, which a lot of patients do have after head trauma, that you should be seeking help by someone who is trained in the field to kind of help give you either some methods or kind of talk you through certain strategies that can kind of help you in the recovery process. So it is a pretty good article. I did enjoy reading through it. There's definitely some interesting points. If sleep and headaches are two of your things and you like going down the medication route, have some interesting things for you to read in there. Potentially you can discuss it with your healthcare provider. And if not, if it's more other things, or if you're looking for a more holistic way to treat the headaches, then maybe this isn't the best article for you, but again, a good read. Hope you guys enjoyed.